everyone, my name is Jen, and I'm going to be presenting my pocket guide to you today for NU 629. So I primarily focus on the pediatric population, however I did add in the other components as well. So I did it in a binder, a full-size binder, and printed everything and put everything in a sleeve to have it nice and organized because I thought this would work best for my practice. So here we have the table of contents, and I split it up by each section. So I have pediatrics, pregnancy, women's health, adult health, and then geriatrics. And I have about 25 entries altogether. So I start out with pediatrics, and as you can see, I have it also labeled off to the side to make it easier to find things. So I start here with the vital signs for pediatrics. Temperature, heart rate, blood pressure, split up by males and females because they do differ. And then I go into reflexes because this is important for children. They should be present, and then they should also not be present at certain ages, so it's important to include that. Then I also have vaccinations. So this chart is from birth to 15 months, and the key shows the orange is when they should be getting it. That's like the standardized time frame. And then the green is if they need to do a catch-up schedule because they did not start on time. And then this one is from 18 months to 18 years, this one over here, with the same color-coded key. So then over here we have preventable diseases by vaccination. So I thought it was good to include for any parent that might be questioning vaccinating their child, and it just shows the different diseases and shows the complications that can arise, so you can communicate with the parents or guardians and just explain a little bit why vaccines can be very important. So then I included developmental milestones for all the children. Start at 2 months, 4 months. We go on to 6 months, then 9 months, 12, 18, 24. Then we have 3 years old and 5 years old. 3, 4, and 5. And each section has social, emotional, language and communication, cognitive, and then movement/physical activity broken down within each section. So that way we can focus on that and see how they're progressing and if they're meeting their milestones. I also just wanted to mention there's a really nice app that the CDC actually has for phones that parents can download, and it helps them follow their children's milestones, and then they can communicate with their pediatrician if their child's not meeting anything or they have any questions. So that way the day of the visit, they don't forget, which I thought was really neat. I actually downloaded it to see how it worked, and it's very interactive, very easy, and user-friendly. So then I go on to health promotion, growth and development. So I broke it down kind of by the same age groups, newborn to a year. It just talks about height, weight, different growth, developmental milestones that they should be reaching. So in toddlers, preschool. Then we have school age and adolescence. For the adolescent section, I did include puberty and what milestones they'll be reaching there and what it will look like. So you can also educate your patient of what they should be expecting moving forward. And then I talked a little bit about psychosocial development because this is a big age for body changes, and sometimes it's very hard for teens to undergo that. I also mentioned screening, so you want to be talking about any like sexual education with them. They get very curious at this age, and you just want to educate them, make sure they're informed, talk about like STDs with them. So I mentioned that. I specifically mentioned chlamydia and gonorrhea as they're two of the most more popular ones for teens. And I just mentioned some different signs and symptoms that they should look out for. I also talk about the depression screening. I chose the PHQ-9 questionnaire. And then I also have in here is the RAPS questionnaire, which I'll show you. So this is the depression screening. Just a few questions to see if the adolescent is depressed or meets any of the criteria, which I can also use later on in the geriatric section, the same exact questionnaire. Then this is the RAPS, which is it's for middle school and high school, and it's to see if they are experiencing any risky behavior. So it's a short questionnaire, and it just helps you assess if maybe they're anorexic, bulimic, using any substances, if they're becoming violent at all, and just like their physical activity. So this questionnaire I thought was really important to include. Then we move on to the psychosocial issues of infants, children, and adolescents. So as a pediatric provider someday, I think this will be important. I mentioned depression, ADHD, and ADD. And then a big one was autism. So I included that. And then I also talk about bullying because bullying is becoming a bigger issue these days, especially with social media. So I just wanted to mention that. I also included the autism screening in the back of my binder that I can easily refer to with the tab at the top. So this is called the CHAT questionnaire, and parents can fill it out, and depending on the answers, it goes into a multiple page questionnaire, and you can help diagnose autism that way. Just gonna get back to where I was. Okay, so back to the bullying. So then we have, it's called the kids list for potentially inappropriate drugs and interactions. So I thought this was important to include. It just has a bunch of medications and which ones are more serious and what the risk is by taking them. So this is 3 pages. And then I included common illnesses of children because as a future pediatric provider, I thought it was important for me to understand certain things. So I included acute otitis media and otitis media effusions, different signs and symptoms, and how to treat them, and just what the presentation would look like for them. So this is the acute otitis media, and it's the rationale for treating it and by age and how to reach the treatment option that you really need. Then I included some pictures of the tympanic membrane and what they look like depending on how severe it is for the ear infection. And then this one is the pictures of the otitis media effusion pictures, just for my own reference moving forward. Some other conditions I included were strep throat, bronchitis, the common cold, bacterial pneumonia, and then I also have allergic rhinitis, so seasonal allergies. Over here I included pictures of strep throat. So this is the normal, what it should look like every day. And then this is someone with strep throat. And then here's just a picture of a throat with strep throat as well. Just have as a reference. So then I also include pediatric nutrition. So I have infants, toddlers, school age, preschool, and adolescents, and just what they should be getting, how much of it, anything that population can sometimes be lacking, so make sure you educate the parents and the patients on different foods that they can eat to help with that. So this is just the average daily intake of a toddler. I thought it was good to include because it is broken down by calorie, and it shows you different foods that are good for them, and it's just a good reference. So now we're moving into pregnancy. So I focused on the antepartum, which is this. This is prenatal history, their initial prenatal visit, what to look for, different screenings that they'll need. And then we have the intrapartum, so this is the phases of labor and what parents can look forward to. Then we have true labor versus false labor. I thought this was good to include because some people don't know and are not educated on that. Then we have pain management for labor and when different options can be used. So medications are always used in the second stage, which I thought was important to include. Then I have postpartum. So I included physical changes. So we have breast, uterus, bowel, bladder, lochia, and then episiotomy and what to expect for those. Then on this side, I included breastfeeding. I thought this was very important, and it is applicable to the pediatrics as well. So moms that are breastfeeding, different positions that work well, what they need to be doing. So always wash their hands before, what type of bras they should be wearing, what to do if they have engorgement, and the positioning of the baby to ensure that there's a proper latch. So then we have non-breastfeeding clients because some women can't breastfeed, some don't want to. So I also talked about bottle feeding and what's really important there, types of different formulas that parents can use, and and just to educate parents on like how to know if your child is getting the proper nutrition, how many wet diapers, how many bowel movements they're having daily. Then I also thought it was important to include postpartum depression, so I included the blues, depression, and then the psychosis. Even as a pediatrician, you're going to be seeing parents and moms, so this is important. You can pick up on signs and you can always refer out if needed. Sometimes they might talk to you and tell you more than they are even telling their own provider. So I thought this was really important to include in my pocket guide. So then I have newborn care, just talks about the different lab tests that they do when they're born, if it's a male, getting a circumcision and educating the parent on that, bathing and when they can begin full submersion bathing versus just cleaning without that. Then feeding, umbilical cord care, which is really important, and then medications that they get right away at birth, including the hepatitis B vaccine. Then we go into the well woman exam. So I thought it was important to include a self-breast exam. I did include some pictures and how they can do it. So different steps. And then include some screening and ages on when they should be screening. So I included mammograms, colonoscopies, and pap smears for cervical cancer. Then this is just the general adult immunization chart. Same key over here. So the orange or yellow is the age that they should be getting it, and if they need to do any catch-up schedules as well. Then we have chronic disorders from childhood to adulthood. So certain conditions and diseases will stay with the patient, and as a pediatrician, you'll deal with it, and then they'll go on, move to adulthood, but they'll still have to manage. So I included type 1 diabetes. I thought this was really important. So signs, symptoms, hyperglycemia versus hypoglycemia. And then I included insulin pumps. A lot of children will use insulin pumps versus injections. I include the different types of insulins and their durations. This is great for patients as well. And then I also included diabetic ketoacidosis, which you want to educate your patient as well as the family on, because that can be life-threatening. I also included asthma. This is a common one. So this is just the different types of medications that are normally used. And then this is the classifications and how severe their asthma is, depending on how you treat it. And then lastly, I included cystic fibrosis because I have worked with patients like that before, so this was important for me to include. So the findings, how that they can manage, treatment, and then complications that they can arise as they head into adulthood or even before then. So then I also just included a quick summary on the adult well visit exam. So just what you're looking for, different screening, and the importance of your yearly physical. Lastly, I have the geriatric section. So I focused on mental health screening for geriatrics. I included the Beers list. I also included a fall risk assessment, and functional status, and the medication reconciliation form. So I thought this was an important section to include as well, because a lot of the geriatric population will be taking care of young children. They could be watching them. They also could have guardianship of them. So it's important to understand this population as well. Their fall risk is super important. If they're taking care of little kids or watching little kids and they're holding them, and their fall risk, that can be very detrimental. So just understanding their ADLs, can they perform them, can they not? So this is the depression screening. This is Beck's depression, so just some questions, and then it tells you the scoring and where they fall. Then I included the Beers list, and this is the potential for inappropriate medication use in the older adult population. So that's here, different medications. Then I have a fall risk assessment that I thought would be a good tool to have as well. And then this is, just like I mentioned earlier, the MCHAT for autism and toddlers and how to use this. So this is the questionnaire. And this is just like the algorithms to how to help diagnose what symptoms the parents are reporting and it's just multiple pages that it rules whether it's a pass or a fail in the end, and if the child will be diagnosed. And for that, you'd also want to bring in other team members, because there's a lot that goes into an autism diagnosis. So that's my pocket guide. I think it'll be very useful moving forward, and thank you.